This is about as good as it gets.
I kind of thought we'd seen almost everything here at the Bondi Clinic. No, we've never had a lion before.
It's just something else. The name's very African. I should have known, really, shouldn't I?
A surprise for Chris has been brought in by Donna and Amanda.
Yes, it is an African name.
They're from Lottle, a specialised welfare home for retired zoo and circus animals.
I think Dr. Chris was extremely surprised when he saw Zambi.
No, he didn't. No. Oh, no, trust me, he did.
He was not expecting a lion cub to come out of that little carrier.
So, I guess the question is, how? How do you have her and what is she doing in here now?
Her mother, Tanza, was acting a bit strange with her. Being the first time mum, she was picking her up a lot, pacing back and forth in the den, wanting to take her out into the big enclosure.
So she just showed quite anxious behaviour, did she?
Yeah, very anxious. Yeah. She seemed a little stressed. We just got too worried, so we thought it was in her best interest to be hand-reared with us.
Absolutely.
When Zambi's mother threatened to harm her, Donna and Amanda became the cub's surrogate mums.
There's no doubt that Donna has done the right thing in taking Zambi away from her mother. It's not ideal, but the reality is, kept in that situation, the risk of an injury just becomes too great. My hope is that you got her away from mum in time and we can transition her into, I guess, her new life now.
Yes, yes.
The first priority really is to establish that she is healthy. She's gone through a lot, so ensuring she's at a good point now can set her up for the rest of her life.
Bubba, let's go.
At the Bondi Referral Hospital Sash, Alana is arriving with 7-month-old Callie.
We noticed that she had some little holes in the top of her mouth. There's a bit of blood around them. So I really have no clue what's going on or what she's done, but it looks like it might be something to worry about.
I'm gonna fix your mouth. Yeah, we'll make you all better.
Callie is definitely my little baby. She's spoiled beyond belief, so I want to make sure that there's nothing wrong with her.
So what's happening?
She likes to chew lots of things.
Yeah.
She's always chewing sticks and rocks and that. But I'm not sure if she's punctured something or got like a hole from chewing on something.
Sure. So I'm just going to have a look in her mouth and see if we can work out exactly what's causing this problem. Oh, doesn't look good. It's only when I open up her mouth that I notice that her canine teeth are sitting far back and they're actually digging their way up into her palate, and that's not normal at all. Those bottom canine teeth, they're actually not sitting where they should be, and what they're doing is they're burrowing up into her palate and they're making those little ulcers, and if we don't do anything about it, those canine teeth will just progressively burrow through her palate and eventually, in the worst case scenario, they can almost make holes right up into her nasal cavity.
That's pretty bad.
Yeah, it's pretty serious if we get to that stage. The best thing we can do is try and treat her now so that it's not going to progress and end up with a serious surgical problem. If we don't treat it, it's going to cause her lifelong pain, discomfort, difficulty eating. It's something we really need to treat straight away.
It's okay. She's just a little baby, so I want to make sure we can do whatever we can to help her. Do the best.
Hi, this is Callie.
Hi, Callie.
And Alana.
Hello.
Alana noticed that she had some little craters on her top palate.
Lisa is hoping specialist veterinary dentist Nadine Fiani can find a solution to help the staffy.
It seems like her lower canines are not occluding in the way that they should. They're just not lining up. But I'd love your opinion on what we can do.
Let's have a look inside. Let's open up that little mouth. Wow. You see the dents right in the roof of her mouth? That certainly does not look right at all. Wow. So this is a pretty nasty problem. You're absolutely right, Lisa.
The first thing I could see was that her two lower canines, her big fang teeth, instead of sitting in this sort of angle, they're actually sitting a little too upright. They're standing up. And what that means is when Callie closes her mouth, those two fang teeth are now poking up into the roof of her mouth, and they're causing dents, they're causing indentations or trauma to the roof of her mouth.
Is there something we can do to help her?
She's very lucky. I think we can probably put on some doggy braces.
Doggy braces, sure. I did not think that they were going to say that she needed braces. I'd never ever heard of a dog with braces. So is it like human braces? Or?
They're a little bit similar to what people can have sometimes on their teeth. We're going to move her upper canines back, and once there's a bit more room, we'll try and shift the problematic lower canines out of the way so that she's not having that painful problem anymore. We're not trying to make her win a beauty contest, we just want her to be comfortable.
Yeah, I don't want her to be in pain, so...
Oh, that's good.
She's the most loved member of our family, so anything that she needs, I will do for her.
Callie will be a pioneer and one of the first dogs ever to have braces fitted at Sash.
Callie's provided us the perfect case for it, and the beauty of this procedure is that it's completely non-invasive.
As horrible as Callie's problem is, the exciting thing is we can put braces on her to fix this. Hey, you're going to get braces on very soon.
Stage 1 of Callie's orthodontic treatment will take place later this afternoon. For now, it's time for Alana to say her goodbyes.
We'll see you soon.
It's pretty amazing that we can do this for her. I'm sure some people are going to think I've lost my mind putting braces on my dog. And they might sort of think I'm just doing it so they look pretty. But we're going to do this so she isn't in any pain anymore.
Is it tasty? I think this is the only line I'd let bite my finger.
At the Bondi Clinic, Chris needs to examine Zambi. After being rejected by her mum, the little line cub is being hand-raised by Donna and Amanda. They need to make sure she's healthy.
Her heart sounds good.
Oh, excellent.
Yeah, heart sounds nice and strong. It's a really critical time right now because without the antibodies coming in from her mother's milk, she is at risk of infection. And that can be from bacterial infections or it can be from viruses. So what I would actually like to do today is give her a vaccination.
Okay, her first vaccine.
Yeah. We're really throwing out the rule book by giving Zambi her vaccination at 4 weeks of age, but I wouldn't forgive myself if she got an infection now that could have been prevented by a vaccination. It's a risk we have to take.
I'll give her my pacifying finger. Good girl, good girl. Oh, there we go. There she's suckling. Good girl. Oh.
Okay, so that's going to make us a little bit more relaxed about her being protected from infection.
Yes.
The other thing she needs is something you can't give in a bottle or in a needle, and that's socialisation. With all this focus on how healthy Zambi is medically, it's easy to forget her social needs, which are just as important. She needs to learn to be a lion. If she's not in a pride, because she's not with a mother, that's where it becomes a bit tricky for her. But what you can do, and this isn't easy, what you can do is actually give her a pride of her own. She can't go into lions because that would probably tear her apart. But what we can do is try to find animals that will accept her, yet still have that team environment. What I'm talking about are dogs.
Yes.
I think we might have the dog. We'll give her a go.
I know which one you're thinking of, Sabi.
Yeah.
What's Sabi?
She's a Labrador.
Yeah.
Yeah. But she keeps everyone else in line at home.
Yeah.
So, I mean, we could give it a go.
When Amanda tells me that her dog is a Labrador, my eyes light up. We are talking about the most perfect surrogate out there, mainly because they're obliging, they're understanding, they're patient, and they're very loving. It's a little bit crazy. I know it sounds a bit weird, but there are situations where this has been done around the world and it has worked very well. But there's no guarantees.
No. She could turn her nose up and say, nope.
Yeah.
Not dealing with that.
Giving Zambi a surrogate mum in the form of a Labrador could potentially be the greatest thing for her. But sometimes these things don't go to plan. I need to be out there to make sure this doesn't go badly.
The idea is that she's going to thrash around, she'll build up like a gator,
At the Australian Reptile Park, Operations Manager Tim Faulkner and his staff are preparing for an extremely dangerous capture.
Well, let's be safe and... OK, we'll meet you around the front, guys.
The park's keepers have recently noticed Atomic Betty, a massive reticulated python, has a large lump on her back. Tim must catch her to have a closer look at the worrying growth.
There is no easy way to catch Atomic Betty. You'll know what to do. 2, 2, 1. Good boy. In. Get that coil off. Head up. Head up. Okay. Everyone grab on. Feet her out. Feet her out. Feet her out. Atomic Betty is a member of the largest python species on Earth. Now, at her size, a bite, teeth are 1 centimetre long, serious cuts, and if she gets a coil around you, you'll hear ribs pop. Watch that head, mate.
After a tense struggle, they've managed to capture the massive 6.5 metre python.
Okay, so bring that bag in. Tail's going to go in first. Start to bring the bag a bit closer, guys. 3, 2, 1, go. Beauty. Now wrap her up. Atomic Betty is one of the reptile park favourites. To think that something's wrong with her, well, I don't like it, and it really worries me.
Excuse us, guys. Cheers, thank you.
Atomic Betty is being moved to a safe area for examination. Tim is aware the python is now extremely agitated and will be ready to strike when the opportunity presents itself.
The first year I ever caught her, I went in and I was about 1 metre away and she just launched at me. And she got a couple of teeth through one of the keeper's nails and it was horrible, blood everywhere. So we always have to be aware of that and manage her very, very safely. Okay, now there's only 4 of us, so let's go up and out. You good, mate? Whoa, whoa, whoa. Look at that. You got her, mate?
Yep.
Just take her over to your left there.
Yeah, we can go down so she's on the ground.
Okay, that's nice. Oh, look at it.
Yeah.
Okay, so that's pretty serious.
Yep.
I'm really worried about that, mate. I can see that and feel that there's bone. I mean, her net's raised, so she needs to go to the vet. All right, guys, let's get her back in now, softly, gently.
Because she's going to go.
Oh, no. We're good. That's almost in. You 2 boys on the head?
Yep. I've got one.
Atomic Betty's never been to the vets before. She's not the type of animal that we'd take off site and get out in a vet clinic, but, you know, this is serious enough that I need to do it. Yeah. Hey. Okay. That's good. She's good. What I really don't want is bad news. Atomic Betty is a beautiful big snake. I mean, surgery would be just a nightmare.
How you going?
Good, Chris. Hi, Chris.
Got some of the relatives over here. Huh?
It is. Thanks for coming out. We really appreciate it.
Yeah, no worries.
Chris is at the Lottle Animal Rescue Centre in Western Sydney. He has a left field idea on how to help 4-week-old Zambi.
All right, should we go and introduce little Zambi to the new mum?
Yes, let's do it.
The tiny cub is being hand-raised by Donna and Amanda, but she needs to learn how to become a lion.
My plan is to do something that seems a little bit strange at first. We're going to try to give Zambi a new mother in the form of a Labrador. What I'm thinking is I'd love to meet our new mum first without Zambi being around. So there's something I want to try that I think is going to ease this introduction.
Why don't you take Chris to meet Zambi? And I'll take the baby. Oh, come on, boy.
All right, which way is she?
There, she's just up here.
Who's he going to be, huh?
There's no shortage of volunteers for the surrogate role.
Here she is here.
She's in there.
Yep.
But one special lab has been singled out.
Calling Sabi.
Sabi? Good girl.
Here we go. That's a good start.
Labradors are known for their maternal instincts, and Chris has big plans for Sabi.
The hope here is that we can create the feeling of a pride of lions. How we're going to do that, though, I haven't told the girls. There is a bit of a trick here. Dogs make up their mind about things as much on the scent of them as they do on the sight of them.
Okay.
So, that's where this comes in handy. So what we're going to do is take Zambi's scent from her body and put it on Zambi. So when she smells Zambi, she's going to go, ooh, that cologne is strangely familiar. This is the best part of the day.
She's loving it.
Huh? This whole motherhood thing, it's not seeming too bad, is it? Okay, let's have the towel started.
Oh, wow.
Let's have the towel is now. Ooh, potent.
It's rank.
All right, Donna, I think we're ready. Okay, so my plan is, this is covered in Sabi scent.
Oh.
What I'm going to do is rub this all over Zambi. So we're essentially trying to fool Sabi into thinking Zambi is a Labrador.
A Labrador. I love it.
Part lion, part Labrador.
Okay. Oh, it's all right.
You don't like that?
Zambi isn't too sure about suddenly smelling like a Labrador, but Chris is hoping his gamble will work.
Right now, all the groundwork has been laid. We have Zambi, who smells like a dog. We have Sabi, who looks like being the perfect mother. I'm excited about how this goes, but at the same time, I'm a little bit wary. This was my idea. If this doesn't go well, I could be leaving here in a hurry.
All right, sweetheart. I'm going to go to sleep.
At Sash, 7-month-old Callie is about to undergo the first of a series of complex procedures to fix her misaligned teeth.
There we go.
If we were to leave Callie's mouth as it is, it's only going to get worse. And what will happen is those two lower canines, those two lower fangs, are just going to keep digging deeper and deeper and deeper into the roof of her mouth. Wow, it's quite the hole. What we're looking at here is the trauma that's happening in Callie's mouth. So these two dents in the roof of her mouth are caused by the lower canine. Every time she closes her mouth, they poke straight into the roof of her mouth. So that's really uncomfortable. So our aim is to eventually be able to move these two canines outward so that they're sitting on the side of her jaw rather than inside the roof of her mouth.
The first step today is applying braces.
We're going to cement on some metal buttons onto her teeth. It's a very delicate procedure, and where they go is very, very important. We just need to let that sit for a minute.
The buttons will hold elastics that will start moving the problem teeth to their correct position.
We have to be very, very careful with how much tension we apply to these teeth. 1, 2, 3, 4, 5. If we put too much tension, if we try and move that tooth too quickly, it could end up killing it, and that's not what we want. That could lead to a whole host of problems. So we have to take our time, we have to measure everything, and we have to make sure what we're doing is spot on. There we go. Perfect.
Stage 1 of this long and complicated process is now over.
I think the buttons and the chains look great. They don't feel like they're going to come off, but she is a puppy and we have to be so careful with her, so she's not allowed to chew on anything because they can come off quite easily.
Oh, it's all right. Callie will sleep off her sedation and hopefully be able to go home with her owner Alana later today.
Hello, mate.
Afternoon, Timmy. How are you?
Good, thanks, mate. How are you?
What's happening?
Near the reptile park in Wyoming, Tim and the team have arrived at the Green Cross Vets Clinic with Atomic Betty.
I hope you got her. Yep, good.
The 11-year-old python has a large lump on her back. Tim is hoping Dr. Peter Nosworthy can determine what's causing the massive swelling.
So we're mid-back with this. Do we have to get her all the way out, do you think?
I think she'll be better up there because it's just better for us with restraint. Okay, now keep coming a little. Here we go. Comes up now, Pete. That's it. So once that's flat, let's keep her there.
She got a bony bump.
What is it?
Oh, what's bone? Well and truly.
What's your first?
Listen, well, first impression's a worry. Touching Betty's lump, I'm concerned that she suffered a fractured vertebrae in her back and that there's the potential to her to be paralysed from that point backwards. We need to have a look at the spine to see whether we've got a straight line vertebrae for a start, that there's no disarticulation.
Yes.
Appreciate that if that's the case, then we've got impingement on the cord.
Yes.
And from there backwards, we're going to have nerve issues.
So what are we going to do now?
Yeah, I want to take an X-ray, if that's all right with you guys.
Yeah, sure. We might just carry her through while she's out?
Yeah, if you're up for that, that's good.
Right, we've got the weight back here. I'm really nervous, my stomach's in knots, and that's because the worst case could unfold. Bit more, Mickey, a little bit more, mate. Okay, that's us. Yep, we're good there. But if these results are bad and she has a broken back, that could end in paralysis, and that's the end of Betty. We don't want that to happen.
X-rays happening, guys. 1, 2, go.
Okay, do you want us to turn her a little?
Yeah.
Atomic Betty's X-rays are underway.
Okay, good. She's done?
She's done.
The 6.5 metre reticulated python has a worrying lump on her back. Tim's concerned Betty might have broken her spine.
Atomic Betty's a really important part of the Australian Reptile Park. She is so loved that for anything to be wrong would be horrible.
We haven't got a lot to smile about, Tim. She has a crack in the vertebrae.
Okay.
Okay, you can see this is bone.
Yep.
That bone should be sitting low. You can see how the vertebrae come up there. That should be sitting. Same as this, they're all sitting next door to each other.
Yep.
That one's sitting up in the air,
yep.
Which means that we have got some pressure on the underside of the spinal cord.
So, Pete, now, are we still looking at a real risk of paralysis?
Oh, without a doubt, yeah. We are looking at a risk of paralysis. If it's left to its own devices, it's left calm, quiet, it may well cement up beautifully.
Yep.
Yeah, and it's like having a fused joint then.
Yep.
That would be what we're after.
Yep.
But it will take 6 months for the bones to heal, and the team will have to follow very strict instructions so the python isn't paralysed.
No climbing, rest, small meals, and the pain-relieving drugs.
Well, I'm not sure whether that's good news or bad news. I guess it could have been worse.
Could have been a lot worse.
It could have been worse. I'm really happy that we brought her here today because until we got those x-rays, we couldn't know the severity of the injury. So, you know, we could have been on a knife's edge where she was about to become paralysed, and maybe by not feeding her big items now and the couple of things we're going to implement, we saved her. Okay, let's go.
At SASH, pioneer patient Callie has recovered from her anaesthetic after having a set of doggy braces fitted.
Come on.
Specialist veterinary dentist Nadine has given her the all clear to go home with owner Alana.
That's your mummy coming to get you. Callie is doing amazingly well this afternoon. You wouldn't even imagine that she was anaesthetised only a couple of hours ago. She's right out of that anaesthetic, no problems at all. Oh my goodness. So much for sedation.
I cannot believe that my dog has braces. I think it is so funny, but hopefully that really, really helps her. So I'm pretty excited.
Hello. 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 You're beautiful.
Callie's next visit will be in 4 weeks.
Oh, thank you for that. That was lovely.
I really do hope that we start seeing that upper canine tooth, that upper fang tooth start to move back gradually, and to do so in a slow and steady fashion, and that we don't end up with any complications from it.
Bye, good luck.
A bit slower when you get to the bottom there, boys.
At the Australian Reptile Park, Tim and the keepers are carefully returning Atomic Betty to her enclosure.
She's heavy.
The 6.5 metre python will need to be handled with care to avoid any more damage to her fractured spine.
It's been a big day for Betty and keepers, but now we know what's wrong with the lump. We know what we've got to do to fix it. Betty needs to get back into her enclosure and just settle down. She needs some rest. Okay, that's it. All right, Betty. I think at least for another year, she doesn't need to be handled. We'll reduce the food items, so hopefully that's enough to get her through. Righto, darling. All you got to do is get better now.
So just remember to take it nice and slow. Obviously, Zambi's never really seen one like Sabi before, and Sabi's never seen one like Zambi before, so we'll just try to go in nice and slowly. Hey.
At the Lottle Animal Rescue Headquarters in suburban Sydney, Chris is about to find out if his bizarre adoption plan will work.
And just be nice and positive, hey.
He's hoping Sabi, the Labrador, will become mum to this 4-week-old lion cub.
I am anxious about this. It could work one way or the other, and Sabi could not want anything to do with the cub at all, or her maternal instincts might kick in, hopefully, and it could all turn out beautifully.
There we go. Oh, just nice and slow, nice and slow. Just licks, there we go. There's certainly no stress or anxiety there. That's a full-on first meeting, but that is a successful first meeting.
Gentle, she's just little, She's only a little oil.
I could tell that Sabi had love to give, but just how much love to give, that was the surprise. But what I find amazing is that she's looked at Zambi and hasn't seen a lion, she's seen one of hers almost, that needs help.
Oh, good girl. I mean, this is a fantastic result, Chris.
It's extraordinary.
I think Chris's idea with the scented cloth helped out lots. She just jumped straight in there and just started being a mother to her.
So, as a first meeting, that really couldn't have gone any better.
Sabi and Zambi will spend the next few months living together. The hope is Sabi will teach Zambi how to live in a pack and set her up for the rest of her life.
After such an enthusiastic first meeting between Sabi and Zambi, it'd be rude not to come back and see how this relationship develops.
Getting sleepy. There we go.
At Sash, the second stage of little Callie's marathon orthodontic program is about to begin.
It's time to get these braces off.
If the braces have done their job, Callie's upper canine teeth should have started to move back.
Oh my God. Out it came. Oh, beautiful. Callie still has those little ulcers in the roof of her mouth, but it's looking pretty good and no longer causing her any pain or discomfort.
The next step is to use dental putty to construct a temporary plate that will start pushing Callie's lower canines clear of the roof of her mouth.
We want to make sure that everything fits together and that we shift the teeth as quickly and as efficiently as possible without causing any problems later on.
Little Callie is now more than halfway through the pioneering program to correct her teeth.
That's very, very nice.
It will be another 4 weeks before she's back in to see if the plate has worked.
Now we'll just have to wait and see if the teeth shift like they should be.
Outside the Bondi Clinic, Cassie is losing the battle with her bulldog George.
Come on, hey.
But the 2-year-old might not be so enthusiastic about his visit to the vet if he knew just what was in store.
I came to see Dr. Chris because I'm concerned about finally desexing him because he's getting out of control. I love his personality. He's just, I want him to calm down. He's just too much.
Hey, how are you?
Hi, good. Oh, Georgie.
Oh, hello. Hi.
Hi. He's
Would you
very
both like
excited
to come through?
see
Clearly,
you. Yeah.
clearly he does. It's been a few years since I first saw George as a puppy. In that time, the little boy has grown up. Wow, okay, he's a man in a hurry. In this one. That one.
Come on.
He's a totally different story now. George, does this have anything to do with why you're here?
He's getting a bit out of control though. When I take him for a walk, it takes forever because he sniffs every single tree. And I'm not sure if I desex him, he's gonna change because it's not enjoyable to take him for a walk anymore.
There's no doubt that George has an excess energy problem, but it's the engine that's driving this beast that is the true issue here. Or is that engines, 2 of them, between his legs. The problem's right before our eyes. They're hard to ignore.
They're massive, aren't they?
They're really big.
They're really big.
Yeah. So the issue is that they're filling up his body with testosterone.
Yeah.
And testosterone has an interesting effect on men. So for him, what it's doing is essentially giving him this drive and this need to be everywhere at every time and be in people's faces because he wants to be the dog that everyone knows and everyone loves, and because he connects that attention and that focus of everyone with him being a successful male alpha dog. So we need to do something.
Yeah.
There you go, Callie.
Today is a huge milestone for courageous Callie.
You're a good girl.
After weeks of intense treatment at Sash, the staffy pup is back for what's hopefully her final procedure.
We're going to be removing her orthodontic appliance today, and hopefully that'll be it. We'll be done.
That's a good girl.
The first step is removing Callie's plate.
We're going to score the appliance itself, and then we're actually going to crack it off bit by bit. We do that very carefully because we don't want to hurt the teeth underneath it.
Today's the big day. Callie is having her plate removed. So excited to see how it turns out.
Oh, there we go. The whole lot just came off. Thank you. Fantastic. So I'll just get the last bits and pieces off. We are going to just make sure that everything's fitting together okay. There we go.
I'm always nervous at this part of the procedure because it's really the moment of truth to see if all the work that we've done has actually been successful. So fingers crossed our teeth fit together properly.
Oh, beautiful. So we can see immediately that now her lower canines are on the outside of her upper canines, which they weren't before. Previously, they were just sitting right in there, inside her palate, inside the roof of her mouth, and they were causing all manner of trauma. So that's no longer the case. The braces, the plate, everything has done its work. Our lower canines are now in completely the right spot. They're not going to poke through the roof of her mouth, but most importantly, she'll be very, very comfortable. Aren't you the prettiest girl now? You're so pretty. Lovely teeth that don't hurt.
At the Bondi Clinic, Chris believes gorgeous George's testes are producing too much testosterone, leading to his dominant and hyperactive behaviour.
By castrating George, you take away that testosterone. You make him less answerable to those urges and more focused on being a patient, maybe even obedient dog.
But Cassie isn't convinced.
And you're worried that it might change his personality?
I'm worried that's not gonna change his personality. I'm worried that he's just gonna be the same.
So I can tell you that he will be calmer, but he's still gonna be a bulldog.
Yeah.
If I was to have my 2 cents here, I would say that for him the best option is the most permanent option, is to actually castrate him.
Yeah. Oh, you're gonna lose your balls.
Cassie doesn't seem ready to commit just yet.
So, if we do the surgery, how long he would stay here? How long does it take?
So just 1 day. So he's in the morning and he goes home that night.
Oh.
Will probably surprise you just how much he copes with it.
Oh, you're gonna miss them, are you? You're gonna miss them?
It's a big decision, and Cassie has opted to delay George's snip.
I'll be honest, unless they actually make the appointment straight away, I'm never too convinced that people are going to carry through with castrating their dogs. With George, he has this social itch that just can't be scratched. No matter how hard he tries, he's always going to end the day disappointed. He's never seen enough people to keep him truly happy.
George, sorry. Jumps a lot.
So for now, gorgeous Georgia's manhood remains intact.
Callie, you're going home, sweetheart. You're going home. Come on, somebody's waiting for you. I know.
Later that afternoon, Callie has slept off her sedation and is ready to be reunited with her devoted owner, Alana.
I can't wait for Alana to see Callie's new smile. They have been through weeks and weeks of procedures, and her devotion and dedication to her dog is quite remarkable. I just can't wait for her to see her little girl at the end of the day. She is going to be so excited. Go, 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 go. Hello, Mama. Hello. Hello. Yes, yes. Hello, princess. Hello. Callie. Callie. Come on. Show Mum your teeth.
Show me.
Oh, look how pretty they are. Oh, Bubba. Got a brand new smile.
Thank you so much.
My pleasure. It's really exciting to have been involved with Callie's treatment. She's now gone from a dog that had a painful mouth to one that's got a beautiful, normal functioning mouth, and she'll go on and lead a happy, healthy life.
Thank you.
Thank you.
Come on, Papa.
See you, Callie. Yeah. She thinks your teeth are beautiful.
Come on, let's go.
It was definitely worth getting the puppy braces for Callie. We can be happy knowing that she's got a long, happy, healthy life ahead of her with plenty of love from all of us.
You know what? It might just be time to catch up with a girl that hasn't been too easy to forget.
Chris is on his way to the Lottle Animal Rescue headquarters in Western Sydney to check up on Zambi, the lion cub.
Oh, hello, my not-so-little girl. How are you?
Wow, what a greeting.
When I first see Zambi running towards me, I'm thinking, oh, she's grown up.
The last time Chris saw little Zambi, she was just 4 weeks old.
This is about as good as it gets, isn't it?
The tiny cub was being hand-raised by Donna and Amanda, but needed a surrogate animal mum to help her develop socially.
Oh, bit bigger than last time?
Just a little.
Now Zambi is 5 months old, Chris wants to see just how his left field idea of having Sabi the Labrador raise the cub has worked out.
Oh, hello. The whole family's here. Hello. Hello. So, was she the mother we hoped she would be?
Oh, she's been wonderful.
Yeah.
Yeah, she's been toileting her for us. She keeps her company, sleeps with her.
She's making a growl like a lion. See, she has
picked up a few things. Sabi's a great mum. Yeah, I couldn't have asked for any better. She looks after her, she sleeps with her, and she's very protective of her. She is the best mum ever.
Sabi, you gotta say, we took a punt on you, huh? We really took a chance on you. We probably asked a lot more of you than one should ever ask of a dog. But you delivered, didn't you?
Sure did.
Bringing Labradors and lions together was always going to be a calculated risk, but it couldn't have gone better. Shall we have a little look at you? Okay. Just going to go over here. Just going to go over here. See, now look what happens, huh? Now you can't leave with it attached to me. Thank you. Oh, this is a great game, isn't it? Huh? It's a perfect game.
I knew this was going to turn into fun and games.
Oh, see, when you chew it, I don't hear your heart, I just hear your chewing. No? Yeah, she sounds good. Good. Yeah. You're being very cooperative now, aren't you? We do need to talk about one thing. This may not go down too well, so I'm going to break it to you slowly. It's vaccination time. So these are often the times where they remind you they are a lion. Not a dog after all.
Look at perfect. Well done. It's a big relief. She's in great health.
But we must say Sabi's done a wonderful job.
Yeah, great.
Yeah, she's fabulous.
It worked a treat that we could put Zambi with the Labradors. It would have been really hard for a human to take over that role as her mum. They've just been so good to her. I couldn't have asked for any better.
You know, I don't normally take time out of the clinic to go and visit art galleries, but today there's a pretty good reason.
My saviour of the day, Chris.
How are you?
Oh, man, good to see you. Very good to see you.
Pressure on too early, all right?
No, but hey, man, anything that's going to help my bird is fantastic for me, so...
Chris is responding to a call for help from local gallery owner Maurizio.
This is Dr. Chris.
Hey, Pretty.
Say hello.
His best friend Pretty the galar has suddenly developed an unusual growth, and Maurizio is concerned.
Now, you're worried about this lump, is that the story?
On the right leg there, yeah.
The moment I lay my eyes on Pretty, straight away, I can see the lump. It's a big size. We're talking about sort of that.
Yeah, exactly.
That size.
It's a few centimetres. It's confusing the hell out of me.
Okay, but it has come up fairly quickly.
It's only in the last 3 months.
How old is he now?
He was 42 around September last year, so he's going on 43.
Wow.
43, yeah. I've had him since I was 11 years old.
Jeez.
Old story.
It's a big part of your life then?
A huge part of my life. He's been with me the whole time. Every day. I literally talk to him over the phone if I'm away. Someone will hold a phone to him, and yeah, he's a big part of the family.
There are a couple of things that worry me. He is getting on.
Yeah.
And look, in the same way as in people, the older they get, the more likely you are to have, I guess, more serious health problems.
Exactly, issues.
So, look, I think probably that the best thing is to get in there with him. Need to get a good look at that lump, but also, importantly, get a feel of that lump too.
Exactly, yeah. Exactly, yeah.
A lump that appears pretty suddenly is cause for enough concern as it is. But when you add on top of that the fact that Pretty is 42 years old, which is really middle to late age for galars, yeah, we've got reason to be concerned.
Sweetie pie.
At the Bondi Referral Hospital Sash, little Sachi is putting on a brave face after being savaged by another dog.
Was she picked up by the dog?
She was in a jaw lock.
Okay. Well, what I'll do is I'll just take her out the back and just have a look at her.
Sachi saw another dog, and this dog was it's a lot larger than Sachi, quite a vicious dog, and started attacking Sachi and had Sachi in a headlock, and it was gruesome to see. It was vicious. It's heartbreaking. It's devastating.
Can I get a hand here? This dog was attacked by another dog. All right, sweetie.
Oh, she's really scared. It's okay, baby.
Whatever dog has attacked Sachi in the park has really injured her. She's in a lot of pain and she could have quite extensive injuries.
It's okay, you're okay. No, it's okay, baby. Sachi, it's okay.
She's really protective over that shoulder. She's just too sore at the moment. Let me touch the leg? Or not?
Sachi's distressed owners, newlyweds Mel and Ben, can't believe how a walk in the park has turned into such a nightmare.
In a situation like this, you almost go into survival mode, or, you know, it's just gut instinct. You do everything and anything you can just to get your animal out of that situation.
Quite a scary thing to sit there and witness, yeah.
Okay, honey, can we see what's happened? Can you let me have a look? All right, doll. Really not bearing any weight on that leg, are you, honey? The things we worry about with dog attacks are crushing injuries and puncture wounds. Puncture wounds can be like the tip of the iceberg. So on the outside we can just see a little puncture, but underneath a lot of damage can be done.
It's all right, mate. We'll get Dr. Chris to have a look at you.
In Wallara, Chris needs to examine Pretty. The 42-year-old galar has a massive lump growing on his leg, and the worry is that it could be cancerous.
Seeing the lump that's formed in the quick time that it has, it concerns me a hell of a lot. It's okay. Baby, get you. It's okay.
There's no denying it. To truly assess what is going on with this lump, I need to get in there and have a good look for myself.
Baby. Baby.
Given the fact that Pretty hasn't been handled for a number of years, it's not going to be easy.
Oh! Oh!
He's got the dominant position.
Hasn't he? If anyone gets close enough to him, he very much defends himself. It's going to be very interesting.
See, Freddie, what you don't realise is that I brought in my #1 bird controlling device. Currently, everything is in Pretty's favour. He's got the height advantage. He knows all the hiding spots, and he's got a pretty sharp beak.
You ever feel like it backs up against the wall, Chris?
Never. But what he doesn't realise is I've got the towel.
Let go. Let go. Good boy. Good boy.
So we just keep you nice and relaxed there, buddy.
With Pretty beginning to fret, Chris has to work fast.
Even though I've successfully managed to catch Pretty, the fact is we cannot delay this examination. It has to be done quickly because stress for a 42-year-old bird could be fatal.
That's okay, baby.
Okay,
You're all right.
You don't want to be like that?
We're not touching it. You're okay.
It's okay. You're okay.
You're all right.
It's okay. It's okay. Good girl. Good girl.
At Sash, Lisa is struggling to get a close look at Sachi's wounds.
Poor little Sachi is so terrified. She's just been attacked by a dog. She's completely traumatised, and now she's got a really sore area over her chest. Good girl, hon. Good girl. It's okay, hon.
Okay. It's okay, Mum. It's okay.
You all right?
It's okay. I know, it's a bit scary.
I'm just going to give Sachi some pain relief before I get anywhere near that wound. She's really, really sore, and she's not letting us have a closer look at it. Okay.
I'm going to make you feel better, okay? It's all right. Good girl. Good girl, Sach. Here you go. Very brave.
Good girl. You'll feel much better now, honey. All right, we won't touch you till that kicks in. Good girl. Hi, come through.
While Sachi's pain settles, Lisa reassures distressed owners Mel and Ben, who witnessed the terrifying attack.
It all happened in a few moments. So Sachi, I mean, they saw each other. Sachi went up, you know, a bit of a yap, as she does, and the other dog just attacked, just went for it.
You poor things, it's really traumatic.
And you almost feel a little bit guilty.
Yeah. I'm looking at Ben and Mel, and I can see how traumatised they are. It must have been so frightening to see their precious little girl in the jaws of another dog, feeling helpless, like there's nothing they can do. And all they want now is for their little girl to get better, and they want us to do everything that we can. She's got a puncture wound. It's not like a big gaping open wound, but it's a couple of puncture wounds there, and then very tender over her shoulder. But I'd still recommend we do an x-ray of her chest just to make sure that everything looks normal. It's much safer to keep her in, if you can, so that we can observe her. If things go badly, we can pick it up instantly and get on top of it before it becomes a big drama. But she's going to come home. She'll come home eventually. She might need to stay here for a little bit, but we'll get her back to you. Okay? Yeah. All right. Hi, Miss Sachi. No jumping out. You give Mummy a cuddle.
No, it's okay. No.
Give me a sort of fright.
Oh, that does look bad. No, it's okay, Sachi. No, it's okay. It's okay.
Okay, Sach. We're going to look after you, darling. We'll look after her, I promise.
So this is the lump here, and it is tucked away in a tricky spot.
Chris is examining a lump on 42-year-old galar, Pretty.
Oh no.
He's hoping it's not cancerous.
We're looking at about 3 centimetres by 3 centimetres. It's movable.
Yep.
See that?
Yep.
Looking at it, it is a tumour. There's no doubt about that. So probably the most important thing is to get a sample of that. The chances of me being able to catch Pretty again are pretty small, so everything has to be done right now, including taking a sample of that lump.
Oh,
there we go.
Good boy.
It's all over.
You okay?
Hopefully in that sample there'll be enough to tell us exactly what type of cell is sitting in that lump.
Sure.
And from there we know what we're dealing with. After feeling this lump, I've got no doubt that it is a tumour, but what kind of tumour and what this tumour really means to Pretty and Maurizio is still a mystery. Have a look down here.
Yeah.
So just picking up this.
Yeah.
This is all his food scraps.
Yes.
So everything that he's eaten. If you go through it all, sunflower seed, sunflower seed. He is having breakfast, lunch, dinner, sunflower seeds.
Yeah, mostly. Yeah.
So this is important, and this may actually be relating back to what we're seeing right now. I'm going to take that sample back to the vet clinic.
Sure.
We're going to analyse that. But I've got a funny feeling right now that what's in my hand is as big a deal as what's in that syringe. All right. So I'll let you know as soon as I have some news.
Thank you. Okay. Very much appreciated.
I'll see you soon.
Yeah. Not sure if he wants to see you soon, but
I'm not going to make eye contact with him right now. We're clearly not talking.
I'm always optimistic, but he is a bird of a certain age. But I am worried about it, definitely, yes.
All right, darling,
It's okay,
we're just going to put this on you so that we can have a look. I'm just putting a muzzle on Sachi because she's really, really sore. I've given her some pain relief, but I want to make sure that I can have a look at that area without her trying to bite.
At Sash, Lisa is urgently trying to get a closer look at Sachi's injuries following a dog attack. And the petrified pooch needs a lot of gentle coaxing.
Little Sachi has been through so much in the last few hours. She's been attacked by a dog 4 times the size of her, been thrown around like a rag doll, and now she's in a vet hospital being poked and prodded around, and she is in agony. Yes, honey, can I have a look at your leg?
Okay. It's okay.
I think what we're seeing is just the tip of the iceberg. The skin wound doesn't look too bad, but I think it's the damage that's underneath there that's causing our problems.
It's okay, baby. I know, it's a little sore. It's a shoulder.
All right. I'm also really worried about Sachi's leg. She really doesn't like me touching it at all. I think what we're going to have to do is take an x-ray of her and examine her under sedation.
Let's see what we've got. Really, when you're dealing with a 42-year-old bird, I guess anything is possible when it comes to a lump. So I'm nervous because we just don't really know what we're dealing with here, and there's a lot of emotion at play.
At the Bondi Clinic, Chris is about to test the cell sample taken from Pretty the galar. The beloved pet of Maurizio recently developed a lump on his leg, and the concern is that it could be cancerous.
It looks like a kid's science project, but what I'm doing is actually using different coloured stains to essentially illuminate different parts of this sample. By doing that, I get a clearer picture about what's happening. Okay, let's take a look. That's interesting. So wherever I go, I'm seeing 2 things. Red blood cells, which are obviously meant to be there, but these white-looking cells, and they are everywhere. And even though they look like they're thousands of bubbles of nothing, they are something. And what they are is fat cells. And right now, that's all I need to know.
Oh, look at this bruising. Oh, darling, that looks really sore. Hey, the doggy really got you.
At Sash, little Sachi is now anaesthetised, so Lisa can finally get a really good look at her injuries.
Now that she's asleep, we'll be able to get some proper x-rays. X-rays of her chest actually look all right. It doesn't seem like that dog has punctured into her chest, which is a good thing. Now I'm just worried about the actual wounds and that shoulder. Sachi's x-rays don't show any obvious abnormalities. There are no signs of fractures or breaks in the bones. I'm worried that she might have some torn muscles or torn ligaments that are causing her not to be able to use that leg properly. I need Andrew, one of our surgeons, to have a feel and see what he thinks.
It's really swollen in here.
Just baffled to work out why she's in so much pain.
With the swelling over this area here, she's had a nasty bite to the pectoral muscles just in there. And I think that might be contributing to feeling a little bit floppy. She's certainly got a little bit of ligamentous damage in here, but I wouldn't be rushing to surgery in the first instance. I think we just need to give it a little bit of time and reassess.
So Andrew's examined Sachi and it looks like her injuries are not surgical at the moment. She has done a lot of soft tissue damage to that right shoulder. So we're going to flush out that wound, keep monitoring her and hope that she doesn't deteriorate.
Pretty, look who's here.
Hey, Pretty.
Il dottore.
Hello. How are you?
In Wallara, Maurizio is about to find out what the future holds for his best mate of 42 years, Pretty the galar.
So I do have the results from that sample we took. It is a lipoma. Essentially, Pretty has a lump there that's made up of fat cells.
Okay.
Now, that can continue to grow, and it can get to the point where it starts to affect his life. What's happening is that he's eating like a king. He's eating sunflower seeds day in, day out. They're all over the base of his cage there.
That's right.
Which are 30–40% fat.
Yeah.
So for him, he's eating all the calories he can possibly squeeze into that little body of his, but he's doing nothing about burning them off. And what happens in a galar's body when they get to this sort of stage is they actually start to produce these fatty lumps, almost out of desperation, as a way of sending the fat somewhere. So I could get in there now and operate, remove this lump. But he's 42 years old. What I think is going to be as effective is doing something else. So this is essentially the best medicine we can buy for Pretty right now.
Yeah.
Take these.
Jeez.
Silver beet. Some spinach.
Wow. Wonder drug.
Some kale.
Kale?
All right. So
good.
That is going to be what keeps him happy during the day.
Not happy with this. And now one thing I have to ask you too, let's fragrance sakes, not fragrance sakes, he loves his pasta. He loves pasta.
Don't tell me this.
He really loves pasta.
Maurizio is now telling me everything that he's ever fed Pretty. It's like some sort of confessional. And it's shocking. So what else does he love?
He likes steak too. He likes the fat off the steak as well. If I can give him sort of spinach and ricotta agnolotti, he doesn't mind it, but he likes a good veal tortellini. Baby, tell him that you like pasta. Tell him it's not my fault. Will you say something in my defence, please?
The tricky thing here is that Maurizio truly believes that he's been doing the right thing for Pretty by giving him what he sees as being a balanced diet. But there's no other way of looking at it. Pretty and Maurizio have ultimately been feeding this tumour. So he's going to eat himself skinny with this correct diet.
He's not going to like me.
He's going to get dessert spoon of millet. Stalk there. Pretty's path to enlightenment is pretty simple. A dessert spoon of millet twice a day, and then green veggies. Kale, silver beet, spinach, readily available. Do those and Pretty will be sitting pretty.
It's just hard to imagine going from pasta, cannoli, steak, fish, chicken, nuts, fruit, to what? 3 different types of grass, basically, and a little bit of millet seed. It's going to be very interesting, very, very interesting.
But the reality is simple. Unless Maurizio stops feeding Pretty fatty food and puts him on a strict diet, the senior citizen won't survive.
You have to promise me, no matter how much he complains, no matter how much he talks to you, no matter how much he probably asks,
and he will,
possibly in Italian, for pasta.
Exactly.
You cannot give in. Because if you give in, you shorten his life.
Yeah, exactly. Look, whatever needs to be done, as you said. You know, it'd be ridiculous to take his life to this extent and not let him live it out.
Did you just go?
It's a bit of an Italian thing when you sort of go, yeah, maybe, huh? What's going on? Oh, it's going to be difficult. Definitely going to be difficult, but difficult versus health and life, there's going to be no comparison between the two. So I have to do something about it, and we are.
This Italian Australian is now eating salad. Pretty's already diving headfirst into his new diet and his life plan. But I really feel like the big test here is Maurizio. If he can not give in to temptation, if he can stay strong, then we've got a real hope of shrinking this tumour.
Ta-da, ta-da, buddy. Thank you, Dr. Chris.
Hello, Elvis. It's your lucky day.
At the Australian Reptile Park, General Manager Tim Faulkner and his fearless keepers are about to feed Elvis.
Hello, Elvis. Look at this, buddy.
On the menu, a massive side of beef.
All animals require enrichment, and that's stimulation that is something different than what they do on any normal day. Now, this big food item for Elvis, it's going to get him excited, it's going to get his blood boiling, but it's also going to stimulate him and stimulate him into doing some natural behaviours, grabbing it, drowning it, and, exciting for us, death rolls and head shakes. So the idea is, once he grabs it, hopefully he rolls, breaks a bit off, and that's our cue. Get in there, get it out. He cannot eat that whole thing or he's not going to eat for a year.
That's the plan. But for Tim and Mike to get the meat to the edge of the water safely, Mick needs to distract Elvis.
Come on. Come on, mate.
Luring him to the other side of the pool.
Come on, buddy. Yeah, come on, come on.
It's a dangerous task. One wrong move and Mick could end up an entree.
Elvis is fired up. He's in attack mode. Mick is trying to get his attention, splashing the water, trying to get Elvis to turn. I don't want to move before he does because he's going to launch out of the water.
Come on, mate. Good boy. Come on.
And if history is anything to go by, this cranky croc won't think twice about making a meal of Mick.
Elvis has eaten a lot of strange things. A lawnmower, his girlfriends, and he's even eaten a camera. Where is he, Mick?
Oh, he's at the corner. He's at the corner.
Okay. Tell us when he's coming, Mickey.
Yep, very good.
Sit him down, nice and close. Okay, he's at the corner.
Just going to bring him around. I'm just going to jump in front of you for a second.
Yep.
Come on now. Come on, mate.
Mick's done his job beautifully. Elvis is fired up and he's coming fast. Now, Mike and I have got to grab the side of beef and launch it to Elvis. But who knows what he might do? I don't want him charging out of the water at us. That's what I'm worried about.
Now, the call I'm about to make, it's not so much an animal in danger, it could be more the family.
Chris has just received an SOS from a mother in northwestern Sydney.
Hello, how are you?
I'm so relieved you're here.
Oh, I heard. Here you go, Chris.
Nick, nice
Nicola and her
to meet you.
family are being held hostage by a snake that has taken up residence in their roof.
These are my 3 little ones. And this is a good friend of mine, Louisa. And then this is my mother-in-law, Trish. She's out from the UK at the moment. So.
This happens all the time in Australia, right?
Yeah, I guess.
I'm pretty sure finding a big snake in your backyard is every parent's nightmare. When you're English, it's even more so. All right, shall we have a look at the snake now and check it out?
Oh, Lordy. Oh, it's moved.
It is awake.
Oh, wonderful.
The moment I see the snake, I know exactly what I'm dealing with. It's a diamond python.
Do they bite or?
Oh, they can if they're pushed.
Provoked, but it's not
stressed.
venomous. I absolutely can't bear snakes. I'm very snake phobic. I'm really hoping that Dr. Chris will be able to bring it down safely and take it away, far away from our house.
The mystery is what it's doing here, I guess. It could be resting.
Yeah.
It could be pregnant.
Yeah. It did have a very full belly yesterday.
Really? Going on that, it may be pregnant and about to lay a whole lot of eggs.
Oh, great. That's super.
You know, you thought having a litter of puppies was cute. Wait until you have a litter of snakes. Diamond pythons are found in coastal bushland areas. So the real mystery for me right now is what a large diamond python is doing under the eaves of a house in the suburbs of Sydney. It just doesn't make sense. So the plan's going to be to get up there and just have a bit of a look, and then I just need to move the snake in a few different ways until I can get a hold.
Right.
Okay?
Right.
What I don't know is what sort of state he or she is in and what sort of mood the snake is in. Does the snake have a name?
What do you call it?
Charlotte.
Charlotte the
Charlotte,
snake.
okay.
To catch Charlotte, Chris is going to need some help.
Who's going to be brave? Come on. Good on you.
Oh, Trish.
Could you just hold on to that for me?
Oh, Trish.
I might need that at one. I might need that at one stage.
Despite being absolutely terrified of snakes, Nicola's English mother-in-law Trish is determined to make this a holiday to remember.
You good there, Trish? Still with me? Don't go running away on me.
Snakes just make my blood run cold, they really do. Snakes are not me at all.
I'm just trying to get a bit of an idea about how big she is and what sort of mood she's in and what she's up to here.
Oh my gosh. She's quite long.
It's big. Normally a diamond python is, say, 2 metres long. This one is pushing 3. Wow, okay, she's very big in the middle of the belly there.
Charlotte is turning out to be a bigger challenge than Chris anticipated.
The fact is, this snake likes its location. It's chosen it for a reason. So for me to get in there and try to move it away, it's not going to like it.
But as soon as Chris attempts to grab Charlotte, the cranky snake is on the run.
So she's just trying to edge away there.
I certainly wouldn't want to be up there because the snake's looking like a bit cross that Dr. Chris is pulling on it. It could turn around and have a bite.
Not many people are happy about being dragged out of bed, and this snake is no different. She's not happy, she's showing it.
Oh my gosh.
Where is he, Mick? Oh, he's at the corner. He's at the corner.
Okay. Tell us when he's coming, Mickey.
Yep, very good.
At the Australian Reptile Park, Tim and the team are about to feed Elvis.
Sit him down, nice and close.
The scary 5-metre croc is going to be fed a massive side of beef to try and stimulate his natural predatory behaviour.
Come on now. Yep, ready?
Right.
He's
What's
coming in.
that, 3. On the rope.
Nice.
Once he grabs it, the first thing he does is takes it straight underwater and tries to drown it.
He's got it.
Oh, look at that. While Elvis is drowning his prey, we need to now get the rope around the tree, tie it off, keep some pressure on it, because that's what he wants to feel, that there's still that pressure there, that it's a big food item. It'll make it feel bigger and he'll go into a death roll. How good was that? And powerful. You can see him starting to move. Here he goes. Wow, that was incredible. Now, he didn't just roll once, but a few times. Crocs use the death roll because they don't have a knife and fork like us. They need to be able to roll and break through bone, muscle, tissue, sinews, and break off a piece that's small enough for them to swallow. And that's about the size of a basketball.
Oh. Straight through the ribs.
Good boy. That's where we want. Jeez. Hey, there we go. That's a good one. All we're waiting for now is for him to break that last corner off. He might do another roll or two, but then he's just going to shake it off. That's when we take cover. Here he goes.
Okay, boys, got it. Let's get it.
Elvis has ripped a piece off about the size of a football. Now, he has to come up to swallow it or it'll take a lung full of water. Now, before he does that, we got to get that big chunk out or he's not going to eat for a year. Chunk out. Yep, chunk out. Beauty. That was amazing. Croc's truly awesome. And he's unharmed, we're unharmed. We got to see a side of Elvis that we wanted to see. And what makes me happiest is just thinking about how Elvis must feel right now.
It's good.
Well done.
Yeah. Got it, rolled it, ate it, and burped.
Yeah, classical croc, eh?
Yeah, that's great.
Thank you. Good boy.
Gosh, oh my gosh.
In suburban Sydney, Chris is struggling to catch Charlotte, the diamond python that has taken up residence in Nicola's roof.
This girl is bigger than I thought, stronger than I thought, and is holding on tight, fighting against my every movement. But all of a sudden, let's go.
Oh my gosh.
And comes crashing down and nearly lands on Trish. Not scared of snakes, Trish? Okay, now she's annoyed. It's all right, guys.
After a struggle, Chris manages to get the feisty intruder under control.
So before we put her in, what we might do is just check her out.
Dr. Chris is just having a look to see if she's okay.
Feeling down her scales, there's the occasional small lump, which is most likely to be a skin parasite, which is common in wild snakes. But it's the big lump that I'm most interested in. That's most likely a meal that she's had. There's no other way of putting it. Charlotte has a pot belly, and given the location, about halfway down her body, this is her stomach. So sitting in that stomach is a meal she's had recently.
I do hope it hasn't got that little dog next door.
I would say, looking at the size of that, we're talking about either a bird or even a small possum. So I'd say what's happened is she's had a big meal and she's been trying to digest that. And so rather than just sit idle out in the bush where she's vulnerable, she's actually come and sought some shelter here with you guys.
Well, I'm glad we helped.
Fortunately for Charlotte, it's a clean bill of health.
Whilst this has been exciting for the kids and the adults, I think everyone would be a lot happier once Charlotte's in the bag. Well done for fighting your fears.
Oh, thank you. Thank you. You've helped me overcome them.
You can tell the folks back home all about it.
Oh, yeah. Yeah, I'll be famous for 5 minutes.
Yeah, and they'll probably never ever come to Australia hearing about this.
No. Australian wildlife. Well, I think I've seen enough for now.
See you later.
Thank you. Thank you so much.
Bye, Charlotte. Thank you. Bye.
We've all overindulged at dinner time, but now it's time for Charlotte to go and sleep it off in a more suitable location. It's time to find you a rock rather than a roof. Let's go.
Later that afternoon, Chris has found a new home for Charlotte, the diamond python he captured at Nicola's house.
Someone's a bit fidgety.
The enormous snake's new address is nearby bushland, not too far away from where she was found.
Yeah, this looks good. It's got plenty of trees around, which they like to climb through, but also plenty of rocks to obviously lie on and get some warmth from, but also have a bit of protection from any sort of predators. Oh, you are keen. After that big meal, Charlotte certainly got a taste of the big city, but now I'd say it's time for a big sleep. Maybe just small, bite-sized meals now. Seeing how quickly she's managed to get up to the top of that tree just shows you that getting up into Nick's roof there, it wouldn't have been a stress whatsoever. Somehow I think this tree is where Charlotte's going to stay until she feels a bit lighter. So you go.
Sachi, guess what time it is, hon? It's time for you to go home. Do you want to go home? Come on.
Oh, good girl, Sach. I know, we won't touch the leg. That's a girl. Oh, good girl. Hey, how's that looking? Hey, that's so much better.
At Sash, it's good news for brave little Sachi. Her bite wounds are on the mend and she's well enough to go home.
Should we go see Mum? Want to see Mum? Let's go.
Owner Mel can't wait to be reunited with her little girl.
The whole dog attack incident has been extremely hard. It's made us really realise that anything can happen in a split second and just how, precious, a life is. So just can't wait to have her home.
Oh, look who's there. Hello. Sachi. As we walk down the corridor and she sets her sights on Mel, Sachi practically jumps out of my arms, starts running around the place like this little puppy, so excited to see her mum.
It's good to pat her. She's so crazy excited though.
But the experience doesn't seem to have tempered the tough pup.
Sachi.
Clearly she hasn't learned her lesson.
Sachi, what did we talk about? As I'm sitting here explaining to Mel Sachi's home care, Sachi starts yapping and barking at every dog that walks into the waiting room. Mel has got a big job ahead of her to control this little one. Hey, you're going to be on a lead all the time, you know that. If you keep behaving like this, no more dog parks. That's it.
Sachi, no barking, no barking. No barking?
You've already been chomped, you don't want it happening again. No, you don't. You've been very lucky this time. If you go do that to another big dog, things could be a lot worse. You're lucky it was just your leg.
Come on, say goodbye.
You're gonna be a good girl for Mummy? You be a good girl, okay? You be a good girl.
Thank you for helping me.
Our
fixing
pleasure.
me.
You're a very lucky girl. My job is done here. I feel confident that Sachi's physical injuries will heal with time.
Thank you so much.
No problem.
Thank you.
Take care.
Thank
and
you.
I hope it never ever happens again. But it's Mel that's got a big job ahead of her to train Sachi to make sure that she never picks a fight with a big dog ever again.
Where's my little girl? Where's my little girl?
I don't think anyone enjoys being on a diet, but with Pretty, the hope was it would actually help him avoid a surgery. I'm just not sure he's going to appreciate that fact.
You find out you haven't been eating your greens, you know what you're going to get, don't you? More biopsies.
It's been 4 months since Chris last saw Pretty and Maurizio.
Hey, Dr. Chris.
How are you?
Good, man. How are you?
I'm good. I'm not checking up, but I am checking up.
Now Chris is back to see whether these two best mates have stuck to the prescribed diet and whether the tumour on Pretty's leg has shrunk.
Pretty used to be on a diet of almost everything, but the highlights, cashews, pasta, ravioli, sunflower seeds, salami. Now, just kale, spinach, silver beet and millet. I think you look amazing. I just want to prove it to myself. There's not much of a swelling there that isn't his leg. Whereas before, there was a real separation where you had a big, thick bubble coming up.
But it was huge before.
He looks healthier. I would think that healthy living has its advantages.
Eat your greens.
Even for someone like me who works with animals all the time, I find it amazing that you can actually shrink down a tumour just by using the right food. But it's exactly what's happened with Pretty.
It's great news for both Pretty and Maurizio.
As hard as it has been to stick to this diet, I'm very happy, obviously, that I've seen the tumour go down myself. Well, I'm happy because he's going to have a longer life and hopefully a better quality of life. Chris, thank you. I do appreciate it very much.
Good luck. For Maurizio and Pretty, they've been together for 42 years, and thankfully, this simple change in his diet could give them 42 more years.